Hello everyone, I am Dr. CHIRAG BANSAL and today I will be telling all of you whether you should opt neurosurgery as a career branch or not based on my experience that I have gathered till now out of my residency in AIIMS New Delhi, MCH Neurosurgery 6 years. सो गाइज न्यूरोसर्जरी एक बहुत ही वंडरफुल ब्रांच है. इसमें तुम अपनी बहुत सी ड्रीम्स को पूरा कर सकते हो जो तुमने डॉक्टर बनने के लिए देखे थे. बट उसके साथ साथ इसके लिए कुछ और पॉइंट्स भी हैं जो तुम्हें ध्यान में रखना है बिफोर चूजिंग इट एज ए कैरियर ब्रांच, बिकॉज इट हैज़ बोथ साइड्स पॉजिटिव एंड नेगेटिव. सो आई विल बी एक्सप्लेनिंग एवरीथिंग इन दिस वीडियो, सो प्लीज़ लिसन टू इट एंड लेट मी नो इफ़ यू हैव एनी फर्दर क्यूरीज. सो लेट्स गेट स्टार्टेड. सो जैसे कि मैंने इस डायग्राम में तुम्हें दिखाया है कि न्यूरोसर्जरी जो है एक बहुत ही वंडरफुल सुपर स्पेशलिटी है जिसमें काफ़ी सारा एड्रेनलिन रश तुम लोगों को मिलेगा जब तुम वार्ड राउंड्स पे रहोगे और जब तुम पेशेंट्स को देखोगे, उनका वर्कअप करोगे, उनको ओटी में ऑपरेट करोगे, पोस्ट ऑप में तुम उनको देखोगे, कोई भी कॉम्प्लिकेशन अगर होती है तुम्हें उसको एड्रेस करना होगा. तो इट हैज़ लॉट ऑफ एड्रेनलिन रश एंड इट हैज़ ए लाइफ सेविंग ब्रांच. एज आई टोल्ड, अगर कोई भी ट्रॉमा का केस तुम्हारे पास आता है तो यू आर द फर्स्ट वन हु, इफ द पेशेंट हैज़ हेड इंजरी, हु कैन सेव द life of the patient and can directly improve the GCS of the patient. So prerequisites before choosing neurosurgery as a career branch, these are explained as like this. You should be ready to sacrifice personal life time for the patient care. मतलब आपको patient care के लिए अपना personal life को कॉम्प्रोमाइज आपको करना पड़ेगा. कांट से लाइक आई कांट कम टू ड्यूटी, आई कांट डू दिस थिंग. इफ द पेशेंट इज अंडर यू, इफ you are looking after the patient, then it is your responsibility to do everything about him. So you are always on duty and your patient is responsibility of yours. And you should have absolute accuracy. There is no chance of error. Margin of error is 0% in neurosurgery, and you should have 100% accuracy whatever you do, whether in any ward work or in OT, because it can directly impact the life of the patient and it can have further consequences later on. And you should have enough stamina to stand in long duration OTs. Neurosurgery usually have long OTs, like some cases like vestibular schwannoma, some difficult and large tumors with mass effect can take around 12 to 13 hours for complete operation, and also maybe longer. So you should have that much of stamina where you have to stand scrubbed in OT case without eating anything, and maybe you might be post duty also that day, but you should be ready to do all this if you want to take up neurosurgery. And your partner, whether your husband or wife, should be cooperative enough and should be understanding that you are in a difficult and hectic branch, and that's why you are not able to give them enough time. Only then you can continue in this branch happily, and your family should also be similar cooperative. And you should be good at fine work and skills, because neurosurgery is all about fine works under microscope, where you have to operate inside the brain and you have to handle the microstructures. If you are not accurate to handle these structures, then you can cause deficits to the patient in post-op. Now, what are the pros? Why you should take up a neurosurgery, and what all will you achieve after taking neurosurgery as a career branch? So point number one is satisfaction. Absolute satisfaction and pride achievement is there when you directly save the patient after some trauma, like if the patient develops EDH after road traffic accident and you do a burr hole and evacuate all the EDH, or you do a decompressive craniectomy, then the patient can directly improve from a poor GCS to complete M6 GCS. So there will be direct satisfaction that you have saved the life of the patient. Respect. Brain is not a easy organ to be touched by anyone, so if you are a neurosurgeon, then you will definitely be getting respect from anyone around, whether your colleagues, your parents, your friends, and also other doctors of other branches. You will be getting enough respect. Money. Neurosurgeons are one of the most earning doctors in society. For every surgery you are paid heavily in neurosurgery, because you are directly going inside the brain and curing the disease of the patient. So it is having a high risk also. So like I told, neurosurgery is a high risk high reward branch. So if you want the reward to be with you, then you should be ready to take the risk also. So it has enough money. Once you are a neurosurgeon, then you can definitely earn a lot. feeling of an absolute doctor. Why tell so? Because absolute doctor, I mean that feeling that you had sometime in childhood, that you will be a great doctor and cure the life of the patient, that you can see directly in neurosurgery, as you are on your toes always as a neurosurgeon and do directly life saving procedures, and you feel like a proud doctor. That feeling may not be there in some other branches. Now, what are the cons? What is the darker side of neurosurgery? Let me explain that also, so that once you decide to take up neurosurgery, you should be ready to accept all these cons also. So once you take up neurosurgery, there is loss of personal life and your relations, because you are not able to invest time into your relations. So if your partner and your family is understanding, only then you can be happy after taking neurosurgery. There might not be enough time for you to relax and take up your hobbies and enjoy and go for a tour. So that much time may not be there after you take up neurosurgery. And prognosis in neurosurgery is not very good, especially if I talk about the brain surgeries. Neurosurgery is the only branch where you directly take death consent in almost every case before taking the patient to OT. So even minor error can affect the prognosis of the patient. So that's why neurosurgery can have bad prognosis also. So you should be ready to see that side also. But with the advent of newer technologies, the prognosis have improved drastically in last few years. Now the spine surgery has a very good prognosis, and even brain surgeries and tumors are responding very well, apart from the tumors which are involving some motor areas or some functional areas, and tumors having mass effect. And other cons of neurosurgery is that there is a costly private setup. Even a microscope needed for practicing neurosurgery cost many crores. So private setup is not very easy in neurosurgery. You need to work in government or corporate setup to practice neurosurgery. If you don't have that much of money. So if you are thinking about setting a private setup, then neurosurgery might not be a branch for you. Liability: as a neurosurgeon, even minor error can make you legally liable for the life of the patient. So you should be very precise and accurate whatever you do, and you should be ready to accept all the challenges as a neurosurgeon. And you should take proper consent of the patient before going for any operation or any surgery, so that you are not getting liable for any other consequences that the patient may have later on. So if you are ready to accept all this, then neurosurgery is a branch for you. As I told, it is a high risk, high reward branch. So if you are still willing to take up this branch, you are most welcome to the department. And at AIIMS we are having a wonderful neurosurgery department. I hope you might be having good results after this year AIIMS CET. So if you are thinking about taking up neurosurgery as your career branch, you can watch this video. I hope this video would help you. Thanks a lot.